I'm really excited to talk with you today and present some information from the healthcare field. And so we have Heidi and Karen joining us. Both of them are with Children's Hospital, but have very specific roles within the hospital and what they do. So I'm actually going to let them introduce themselves and kind of what role they have. And we're going to actually start the conversation, ladies, if you don't mind, answering the question, tell us one thing you love about being in healthcare and one thing you don't particularly love about being in healthcare. And I'm sure with all of the circumstances of this past year specifically, maybe some things have risen to the top that you didn't particularly love about this past year. So I'm just going to turn it over to you, Karen. I'm going to let you go first. And please correct me, am I pronouncing your first name right? Is it Karen or Karen?
It's Karen. You're doing great.
Wonderful. Okay, great. Well, I'm going to turn it over to you and just kind of let you introduce yourself and tell us about what you do.
My name's Karen Rowan. I actually had a son that went to Vista Ridge, so I'm happy to be able to do this and present to you guys. I have been a physical therapist actually in Colorado Springs for almost 30 years, which makes me feel super old. But but everybody tells me it makes me seasoned and have a lot of experience. I am a physical therapist, and I'm currently a physical therapist or the associate clinical manager of physical therapy in Colorado Springs. And we have two locations. We have one at our Briargate location, and then we have another outpatient clinic at our Printers Park location. And so I manage both of those facilities. I have about 18 employees currently. We are trying to hire for 2 positions. And my day kind of looks like rounding, kind of checking things out, making sure the facility looks good, making sure all the team members are there and don't need anything, or if they do need something, then I go and I help them find it. If somebody's off, then either trying to find coverage or trying to help cancel patients, or at least kind of get the processes going. I also have to attend meetings, and then some of my day is actually spent doing some clinical treatment. I back up all of our casting therapists. So if you need a splint or a cast, I can see them. I also sometimes cover evaluations. I cover club foot clinic or rehab clinic. So I think one of the things I love about my job, which is one of the questions, is that there's a lot of variety. Every day's different. I kind of come in and you never know what's gonna happen, who's gonna be there, and what new things are gonna pop up during the day. And so that's one thing I love about the job. I also love the people. I mean, everybody that's there is there to help kids and families get better or overcome an injury or a disability. And so one of the things that I love about it is that everybody's there because they care and they want to help people get better. There really isn't much I don't love. I would say that though, since COVID, I don't love wearing a face shield on top of a mask when you're treating kids, because it gets really hot and sweaty and it's just uncomfortable. And then when you figure you're doing that for 8 hours a day or more, it just gets a little tedious, but it's necessary to prevent the spread of COVID. And but that isn't something that I love.
That makes total sense. How about you, Heidi? I'm going to let you introduce yourself as well.
Great. Thanks, everybody, for having us. I'm excited to be here to talk to everyone. So just like Karen, I'm going to start with first what I love and maybe don't love so much, but it's very similar. So most of us go into the health field because we love working with people and we love the opportunity and flexibility that healthcare provides. So I'll share a little bit when I'm talking about my background, just to give you a sense of all the different roles I've worked. So I've been a nurse for 21 years and I've done so many different things, and that's what I love. I'm never really going to get bored with working in this field because there's so many opportunities and so many different directions that my career can go in. I think one thing that I don't love is that it's hard work and burnout is common in healthcare. And so sometimes caring for people and giving your all every day can really make you tired and stress you out. And so I think that is easily balanced out by having things to do to help with stress, things to relax when you're not at work, ways to, spend time with family and friends and all of that. So there's definitely ways to curb that from happening, but unfortunately it's a reality of many fields, and healthcare being one of those where you see burnout quite a bit. So, so a little bit more about me. So as I mentioned, I've been a nurse for 21 years, but I don't work in a typical nursing role right now. So I'm not taking care of patients. I did that for about the first 10 years of my career. Worked in the hospital, loved that. But working nights, working weekends, holidays, it wears on you as well. Though I have to say, working 3 12-hour shifts was amazing, and having 4 days off a week is great. So there are perks to that if you work in a hospital. But then I spent a couple years traveling, and there's these wonderful positions. There are travel nurses, there's traveling respiratory therapists, other roles where every 13 weeks you can move to a different state, to a different hospital, and you're contracted to work there. And so my husband and I at the time, we didn't have any kids, and we moved every 13 weeks to a different state, and we're able to see a ton of the United States. So it was a fascinating time. We really enjoyed it. This was before we had children. So we often think to ourselves, why didn't we keep doing that? That was the life. So there's, a lot of opportunities like that when you're in healthcare, because the demand is everywhere. So the ability to be able to move and relocate or try new things really often is available to you. And then after that, we came back to Colorado, and I worked in public health, and I worked at the Tri-County Health Department. So Tri-County Health Department covers Adams, Arapahoe, and Douglas counties. And I actually worked in a program for children with special needs, so kids with disabilities and chronic illnesses. And I would go to their house, visit with their parents, sometimes go to doctor's appointments with them, help them apply for certain programs, insurance, those kinds of things. Some of the kids I would help get ramps built for their house if they were in a wheelchair. So Karen, a lot of things probably Karen does on the therapy side, right? I was doing on the side of trying to help navigate that transition from the hospital to home, and make sure that they were set up. And then I came back to Children's Hospital as advanced practice nurse, just meaning that I have my master's degree. And so I became the clinical expert on a unit. And so I helped with education, teaching, and orienting new staff, just serving as a resource, helping write hospital policies and procedures. So very different kinds of work. I also did some research, and so I loved that research arm of it, which is why I'm now working on my PhD, so my doctorate degree, because I'm interested in research. And then 4 years ago, I took a drastic change, mostly because I was starting my doctoral degree and I needed a little bit of change and not 24/7 work on a busy hospital unit. And I became the drug diversion prevention officer for the hospital. And so most people have no idea that a role like this exists. They wanted either a pharmacist or a nurse in this role because of our clinical background. But what I do is I actually monitor our medications across the hospital and all of our settings to see if there's ever drug theft that might be happening with those medications. So it is a sad reality of the state of affairs. Many of you have probably heard about the opioid epidemic and how, lots of people are struggling with substance use, addiction. And unfortunately, that happens in healthcare too. So we do see healthcare employees who struggle with addiction, and sometimes they take medications from the hospital for themselves. Sometimes they take them for loved ones. And so I investigate those cases where we might have lost medication because someone is taking it. So fortunately, it doesn't happen very often, but it does happen. And so that is now my job. So I turned from a nurse to a nurse investigator, very different career, but very interesting. And there's a lot of need there. And having that same love for people and that compassion is really important in the role that I'm in now. So.
Wow, it sounds like the diversity and the opportunity, like you mentioned. I personally did not know that much diversity existed in the healthcare field. I mean, I typically think of things like IT, or human resources or marketing or billing, those kinds of things. But I never even thought about the two arenas, with the drug prevention that you mentioned and that sort of thing. I mean, that's really fascinating. Students, I just want to encourage you, just like Mr. Brandt did, again, if you have questions for these ladies, now is your time. You can put them in the chat. You can raise your hand. If you have access to the reactions, you can raise your hand. But I'm going to just kind of keep rolling with some questions unless I see some questions come in on the chat. So my next question for both of you, and Heidi, I'll let you start this time. If you could do high school over again, is there anything that you would have done differently?
Oh, that's a great question. My kids are too young to be entering high school, but we are actually, our community is building a new high school and we've been somewhat involved in that build. And one thing that I love about this high school near our house is the project-based learning approach. And so I would say any and all opportunities that you have as a high school student to get hands-on experience, to do things like this, right? To talk to people out in a field that you're interested in, to do volunteer opportunities where you can learn about different jobs that are available, any of those kinds of things, I definitely encourage. So for me, I was fortunate when I was, I believe just my senior year, but it may have started in my junior year. It was similar to an internship at Children's Hospital, but I was able to do that and get school credit for it. And so I got a lot of exposure at Children's. And that's when I realized I thought I wanted to go into medical school. And it wasn't until that exposure that I realized, wait a second, like the doctors don't spend a whole lot of time with the patients. It's the nurses who are in there spending all those hours with the family, getting to know them, really taking care of the patient. And so that's when I recognized that it was probably nursing that I was most interested in instead of becoming a physician. And so getting that exposure really helped then focus in on my college courses that I took and the direction that I headed. But I also had the opportunity to form some relationships and connections and get to know people. So if I would have had the opportunity to do high school again and I had more of those opportunities, I definitely would have taken all the opportunities that I could have had. And even if you don't know what you want to do at the time, I thought I wanted to be in healthcare, just expanding your horizons with trying a bunch of different things is a perfect time to be doing it when you're in high school and really just getting that exposure. So
that's great advice. Thank you for sharing that. Karen, how about you? If you had the opportunity to do high school over again, is there anything that you would have done differently?
I would absolutely have taken advantage of trying to get credit for college courses that would transfer into other into colleges that I wanted to go to. On the back end of that, when you're paying off $100,000 worth of student loans or $80,000 worth of student loans, you don't really appreciate. I went to a small high school in Nebraska, and so we didn't have that opportunity. But now that's one thing I would totally take advantage of because I understand the value of that and how getting a lot of those prerequisites out of your way for, I don't know, $15 or something through Pikes Peak is hugely valuable. And I would have paid more attention to that and done that. It would have saved me a lot of money. The other thing I would have done is taken advantage of some of the shadowing programs that some of the high schools have within the community, much like Heidi said, being able to, just observe different medical professions or even businesses. I mean, I think just trying to get a different feel for the different avenues in healthcare. I know when we have students come sometimes, well, prior to COVID, when we had students come, they would be able, if you would come to our outpatient facility, you would actually be able to see physical therapy, occupational therapy, speech language therapy, and learning services. And so just being able to see different, what different people in medical fields do, I think is just a hugely valuable experience. And it kind of gives you different exposure to what's out there. I think a lot of people, they kind of know what their parents do and their parents' friends do, but they don't really know a lot beyond that. And so taking advantage of different, take your kid to work day or something like that and shadowing, I think is very valuable. And I think it's hard to sometimes, especially today, figure out what you want to do with your life. And a lot of people take gap years, which I think is fabulous, but I think sometimes these programs can help students that are kind of on the fence about what they want to do really kind of sort out different things and kind of work through that.
That's awesome advice. I often tell my students that I get to work with. I've been doing, kind of college and career advising for the last 10 years of my career. And I will never, ever forget that I had one student in particular a couple of years ago that was just so ready to go into PT. She wanted to be a physical therapist. She knew that pretty much since 8th grade. I think she had an injury when she was a younger kiddo. And so she ended up going through PT herself. But she just really, really absolutely believed that that was the direction that she wanted to go. And around her sophomore, junior year, it was time for her. I was like, let's do it. Let's go do a job shadow. Let's set that up. And we worked with a local PT office here in the Springs. She went in, she was so excited. She wanted to spend as much time as she possibly could that day with the PT. And it ended up that like the second or third patient first thing in the morning was doing some ankle and foot rehab. And as soon as the PT touched that person's foot, she totally freaked out. She freaked out. And she came back to my office that same day because it was such a eye-opening experience for her. She's like, Mrs. Ferguson, I have to touch people's feet if I'm going to be a PT. She's like, I can't do that. I'm not going to be a PT. And so for her, what an eye-opening experience for her to figure that out before she committed to, the long-term program of physical therapy, because there's a lot of education, there's a lot of hands-on, there's a lot of medical classes, biology, anatomy, physiology, all that kind of stuff that she would have to take, which is all great book smart stuff. And it's super important, but the actual process of bringing somebody back from an injury or from something that prevents them from being functional in what they would feel like is a normal lifestyle, she really was surprised that she would have to touch somebody's feet. So we ended up kind of changing gears with her a little bit. She still wanted to stay in the medical field, but just doing something that wasn't quite so touchy.
Right. Yeah. That is a reality. When you're especially, well, I think in a lot of medical professions, unless you really specialize, you're kind of looking at the whole body. And so that's part of what I love about it. You have to know a lot about a lot of different things, but yeah, if you don't like feet, it can be a game changer. So
it can be. So tell us a little bit about, the type of education that you have to have, depending on, I understand through PPCC, obviously, because we have a great partnership. District 49 has a great partnership with PPCC for concurrent enrollment, and they have the opportunity to do their nursing, pre-nursing prerequisites, those kinds of things. But as far as being an actual nurse or being an actual PT, what type of education did you have to get? And Heidi, I heard you say that you're currently working on your PhD. So can you tell us a little bit just about kind of the steps in your educational journey that you ended up taking once you graduated from high school?
Yeah, so once I graduated from high school, I went to get my bachelor's degree. And originally, as I mentioned, I was thinking I wanted to be in medicine. So I was still pursuing that track. So I chose a degree focus in biology, though I want to let you know right now, the schools are really encouraging students to have very varying degrees, a lot of diversity there in the training, and actually sometimes prefer to see students with degrees that are different than the sciences, because you have to have all those science courses anyway. I know when I was hiring nurses and others in different roles in the past, I love to see nurses coming in with degrees in Spanish, or nurses coming in with, business degrees, or things where they came in really well-rounded. They had a lot of different background and exposure. So with that being said, you just have to decide what's best for you. But most organizations will hire nurses with a bachelor's degree. You can become a nurse with an associate's degree, and you can get licensed as a registered nurse through the state of Colorado with an associate's degree, but most organizations are moving towards bachelor's prepared nurses and have been for probably at least the last decade or a little bit longer than that. So I would plan, if you're interested in becoming a nurse, that you take that route for a bachelor's degree. There are some programs, as you mentioned, like some of the community colleges or other schools where you can get all your core classes in, all your science classes, finish up any math classes if you didn't transfer credits from high school for math. And then you'll also do like anatomy and pathophysiology, those types of classes, which are fascinating and amazing. And if you love the human body and people, they might be hard to get through working in an anatomy lab, but it's really fascinating and you'll learn so much through those types of classes. But for me, my first degree was in psychology. So I got a bachelor's in psychology and then transitioned to a nursing school, and in 1 year did an accelerated bachelor's of science in nursing. So I basically had all my prerequisites and core classes, and then it was just doing all my nursing specific classes. So the nursing coursework includes things like pharmacology, so learning about medications. It includes, again, some more of the pathophysiology, what are different diseases and how do those impact the body? How does the body respond to those? And then the courses that are specific to all the phases of life. So pediatric specific courses looking at infants, children, toddlers, all the way up through adolescence. And then we did adult classes as well as geriatric classes. So the elderly, like over 65 population, because the things that you see in healthcare are different in the different populations that you look at and that you will work with, you have to learn about those specific things through coursework. So those classes really are about really the disease processes in nursing. So they really focus in, and that's what nursing school will be if you go to a school that offers a nursing degree, or you go to school that doesn't and then you transition into one. Really, that last year or two is when you do that coursework. And also during that time in your bachelor's degree, you do all your clinical hours. And I don't know what the minimum clinical hours now, but that's where you actually go into job sites, you go into hospitals, to clinics, to schools, to do school nursing rounds. Some of those rotations happen. There's prisons where you could do rotations in the prisons, in psychiatric or mental health hospitals. There's rotations as well. You work with adults, you work with peds, all of that. And so that is where you get some of that exposure. So hopefully by the time you get into your degree program, you know for sure you want to be a nurse, but you may not know in which field or specialty you want to work in. And after doing those clinicals, most people know then by the time they graduate, oh, I really loved pediatrics. I love working with kids. That's where I want to be. Or I really loved, whatever field it is. I really love surgery, so I want to work on a surgical floor. So that usually is, a typical 4-year degree. You do a few years of prerequisites and then nursing. For me, it was 5 because I did my undergrad in psychology and then 1 year in nursing. And then really that's all you need. You then have to take a licensing exam. So you take the NCLEX exam to become eligible to be licensed. And that's, hopefully all your coursework has prepared you for that, but it is a computer-based test that you sit down, you got to get through all those few hundred questions that are in there. You take that exam, and then once you've passed that, then you're eligible to be licensed. And then you get licensed. It's a fee that you pay, and you register through the Department of Regulatory Agencies in Colorado through the licensing board. And every 2 years, you have to renew your license here in Colorado. You have to be practicing as a nurse. There's a few other requirements. Some states require that you're taking continuing education classes in order to be relicensed. But that point, essentially, with a bachelor's degree and licensed in the state, you can work in almost any nursing role. If you're interested in doing more, which I was, and I kept going, I got my master's degree, which then allows you to be more independent and practice a little bit more like a physician or have some leadership roles. And there's several different roles. And so I did that and worked as a clinical nurse specialist. I kind of briefly described that. And then only for those of us that are really interested in continuing to go back to school and do more, you absolutely do not have to get a doctorate degree, but a lot of nurses do. And you can get a doctorate degree to continue to work in clinical practice. That would be a nursing doctorate. Or you can get a PhD, which is a doctorate in philosophy, which is a research degree, which is what I'm doing. A lot of people get a doctorate degree to teach nursing and to teach at the college level. You can get a PhD or a ND degree. Or the DNP degree, sorry, is what it is now, the nursing doctorate. You can get that to teach. You can also get it to just for your clinical practice, or you can get it to do research with that PhD. And so I'm not interested in teaching full time. I do like to teach, but that's not what I want to do with the rest of my life. I want to do research. And so I'll do that research, but hopefully that answers a wide variety of things again. And
Yeah.
you can
Yeah.
choose your own track and how far you want to go. But really, I do recommend that bachelor's degree because I think there's just a lot more opportunity there.
That's great. And just out of curiosity, have you worked ever for an organization that helps you pay for some of your college experience beyond your bachelor's?
Yeah, Children's Hospital does have a tuition reimbursement program. It was put on pause with COVID, but we're hoping it will come back. But it does help depending on where you work. For example, if you work at University of Colorado Healthcare System, I've not worked there, but I know because they're affiliated with the university, they actually cover for all their employees like 9 credit hours per year. And that's pretty significant, where Children's reimburses you. So you pay up front and then they reimburse you. And it usually covers at least 1 class a year. Sometimes it's a little bit more depending on what program and how expensive those credits are. A lot of healthcare organizations offer programs like that, either money to pay for it or scholarships that you can apply for, or actually work with the university and you get free coursework. So definitely look into those opportunities. Sometimes you have to work for an organization for at least a year before you get that. It varies, but yes.
That's awesome. I mean, to me, that just speaks volumes about pouring back into the staff to help them continue to learn new things, but also potentially go down different avenues within healthcare. And so that's awesome. I mean, not a ton of companies continue to offer those kinds of benefits to employees. And so it's great that hearing that healthcare really does try to reinvest that money and that education into their staff. That's great. Karen, any other thoughts on that one from your angle?
Yes, we in the nationally, physical therapist programs have all converted to doctorate degrees. So when you come out and graduate, you'll have your doctorate. So that turns into, depending on how the programs are run, that can turn into anywhere from about 6 years of school to 7, just depending on, do they have a pre-physical therapy track already? Or do you have to get your degree in biology or some kind of science, exercise physiology, kinesiology, and then kind of transition into a physical therapy program? One thing I would say is, if you think you want to go to school for physical therapy or actually anything, I would look and see what the prerequisites are to get into that. I had wanted to go to Texas Women's University because I thought that was the best PT school in the state and the farthest one away from home that I thought I could handle. And then you ended up needing zoology to get into it. And so, which the school that I was at didn't have. So I was going to have to drive an hour to go to that class to get zoology. And so I really had to kind of change my goal and what school I wanted to go to, because I just didn't have enough time to get all that handled, nor the resources to be able to drive. And I didn't want to take the bus, to be honest. So it was just one of those things where you just had to know what you want to do ahead of time, and then spend time looking around at what kind of scholarships you can get, what kind of opportunities there are, and if they have little weird one-off things that might be a game changer for you. The other thing I was going to say is Pikes Peak Community College is setting up a physical therapy assistant school. And so physical therapy assistants can't do evaluations, but they can treat patients. And so it's another way to get into the medical field. I think a lot of people that go to physical therapy assistant school sometimes go on to being a physical therapist. And so it's just another way to get different experience. And they're actually setting up that program. So I believe the first class they're trying to graduate is in 2023, which sounds far off now, but they're just building the program and trying to get accredited. And I'm actually on the board to assist with that and look at the curriculum and stuff. So
That's
and then we also are licensed in the state of Colorado. We have to renew our license every 2 years. You have to take a board exam. once you graduate from physical therapy school to practice. So there's that.
So there's definitely some ongoing education components for both roles, the multiple roles actually that you guys have both held. And so
Yes.
I think that's good for students to know too, that, you know, the education piece, the biggest chunk of it will probably come with the undergraduate degree, and in the PT case with moving towards the doctorate as well. But
Mhm.
then beyond that, there will be opportunities to continue to grow the knowledge and the experience base, which is great.
Yeah.
We
I
do have, oh, sorry, go ahead, Heidi.
Yeah, I saw there were some questions. I want to add though, Karen brought up a great point with the physical therapy assistants, is there's roles like that all through medicine, right? Technician positions, or in nursing, the clinical nursing assistant, where you don't have to have a bachelor's degree for all of those. Some of them you do, but some of them you don't. You have to have some coursework or certificate type training classes that are relevant to that work. So radiology techs,
Mhm.
surgery technicians, nurse, right, nurse assistants, PT techs, all of these different roles. So if you don't think a 4-year degree is where you want to go, but you still want to work in healthcare, there's a ton of opportunities. And so I don't want to discourage you if, you know, if you're nervous about that, or you think, well, I'd love to work in healthcare, but I just don't know if I want to go get a bachelor's degree or a doctorate degree for those roles that require them. And so same thing, I saw some questions about vet medicine. If you're going to be a vet, you actually do have quite a bit of schooling, but there's vet techs, right? Positions where you would get that exposure to learn a lot about animals, be taking care of them, doing a whole lot of hands-on work. And all of those roles you interact with either the patient, the animal, or the person quite a bit as well. It just changes what you're able to be doing, what you're licensed to do, and how much of that falls within your role. So the question about is being a nurse or being in the medical field anything like veterinary medicine, I think a lot of the coursework and preparation is similar. All the science classes and health classes and those kinds of things you'll take, except the focus will shift from a human body to animal bodies. You'll take anatomy classes relevant to the animals, not to the human. And then your clinical hours will be labs or clinical experiences in vet practices or those kinds of things. But otherwise, up until again, probably that last year or 2 years of training, it will be very similar. And then it will transition. So
Great. There was another question too about mental health and substance abuse workers. What do you, if either of you have some insight into what type of schooling they would have to do, how far they would have to go in order to be mental health and substance abuse workers?
Typically with social work or any kind of that kind, you need a master's degree in social work to kind of do that kind of thing.
yeah, again, there's a lot of different roles, just like there is in PT or in nursing. Same thing around substance use. There's substance use counselors, which do more training-based programs without always a degree behind it, where you would be more like a peer support and meeting with individuals with substance use. Then there's the social workers or the psychologists or the psychiatrists that might work with you, who have usually at least a master's, sometimes a doctorate degree as well. And it just depends on what role you're interested in. There's peer workers, individuals, you know, who come alongside and work with people with substance use disorders too, who have life experience, not school experience necessarily. So it really depends what your specific question is. We do have mental health workers at Children's Hospital. Many of them have bachelor's degree, and they actually are the ones that do one-on-one care with our patients who are admitted, that work with them during their hospitalization, coach them through activities, but they work collectively with a team of doctors, psychiatrists, social workers, individuals who are actually supporting and determining care for those individuals. So again, wide variety of roles. So this is why Karen and I both said we love healthcare. There's just so many opportunities, right? And it's different every day. And so things like this, it's really good to ask lots of questions. So if you know you're interested in mental health and substance, start asking questions, start looking into jobs online, seeing what's posted. What does it mean to be a behavioral health specialist or a mental health worker or a psychologist or a substance abuse treatment provider, right? They're all very different types of roles, lots of opportunity there. So
That's great. One other question that came up in the chat is about the job openings in the state of Colorado in nursing specifically. We continually hear, that there's a shortage of nurses nationwide, but can you shed some light into what might be happening just within our own state?
yeah, so definitely there's a shortage of nursing, a shortage of nurses with experience. And so that's where there's a ton of opportunities and positions always available for nurses with experience. What you'll find is because of the shortage, right? Schools increased their enrollment for new nurses and trained a bunch of new nurses, and they're putting out a bunch of new nurses, and those jobs are often a lot harder to come by. And so to just be fair, you have to be flexible and patient, and where you're going to get your first job. It may not be your ideal job that you're going to be in the rest of your life, but you get a job, you get some experience, and then you go from there. So Children's has an amazing new graduate residency program. A lot of hospitals have residency programs. I recommend that if you have the opportunity to go into a program like that, because you learn with a group of other new nurses, usually for at least a year. You get special classes, you get a lot of support, but those roles are really, and those spaces are limited. So we hire 40 new graduate nurses about 3 times, I believe, a year. And last I knew, the stats could be a little bit different, we would get at least 300 plus applications for those 40 positions. So very competitive to get in, which is why I suggest volunteer experience, build your resume, right? Do job training exposure, get various degrees, do travel if you can. Like I traveled out of the country a couple different times to learn Spanish, but to also work in hospitals in Costa Rica and in Mexico, and those types of experiences. And the more you can prepare yourself to say, I know I want to be a nurse and I'm coming in with some of this experience already, can really make or break how you compare next to the person that's interviewing before or after you. So any of that type of thing. Some nurses, when they get into school, will get their CNA or clinical nursing assistant certificate and start working, and that helps with getting some experience and exposure. So those new positions are hard to find because there's so many people coming out of school that want them. But there's still plenty of jobs for nurses available, even new nurses. You just may have to work somewhere that isn't your ideal place for a first year or two, get some experience. And then once you have a year or two of experience, those are the positions where there's always openings and you can find in a lot of different places. So, yeah.
That's great advice. Karen, anything else that you would add on that?
I would just say there's just a lot of variety in healthcare in general. Like in physical therapy, you can work with kids, you can work with adults, you can work inpatient, you can work outpatient, you can work in cardiology, you can work in oncology, you can work in, with doing some pulmonary work. There's different clinics you can be in. So you can do private practice, you can do sports med, you can do orthopedics, you can do neurology. So I think, one of the questions in the chat, and I'm sure it works similar to nursing, is it hard to change paths? Excuse me. I would say, no, I think the more experience you get and the more you learn in different fields, I think then you can carry a lot of that with you to the next track that you want to go on. And so does it take some time sometimes to cross over? Yes. But in general, is it hard to switch? I don't think it is. I think you just have to know kind of what you want to go down, what you like, what you don't like, and then you just have to take the time and pursue it. And so I think the variety is a nice thing about the medical field. Even during COVID, we all worked. We all had jobs and had to go in. People still, so when a lot of people were, not working or forced to stay home, we were part of the emergency care teams that had to go in and work. So I think there's just a lot of variety, and that's one of the things that's very appealing to it. Is there's, like Heidi said, there's a lot of different tracks. You can go in at an entry level and do things and work your way up, and that's just not. You can work at a hospital and be in business. You can work at the hospital and be in in accounting. And so there's just a lot of different roles that you can fill.
That's great advice. For our students that have to log off at 8:15, and our two speakers will actually be logging off at 8:15 as well. But what I wanted to mention is Mr. Brandt has probably worked through some use science with you guys on your campuses that will help you do some discovery about different career paths. I would really encourage you on the careers tab of use science, go ahead and start researching some of these career fields that these two panelists have brought up. There's going to be a multitude of information on U Science that talks about careers specifically in healthcare. And so I would say first and foremost, take advantage of the research that's right at your fingertips. The other thing is that, as both ladies mentioned, there are opportunities to volunteer in the hospitals. It may be a little bit different. It might look a little bit different in light of COVID, but I know that there are many, many opportunities for students to start the volunteering process. I think as young as 16, maybe even younger than that, depending on the facility that you're looking at. And the last thing I want to mention to students that are really interested in going into the healthcare arena, I know in the past UC Health and Memorial Hospital, that partnership, they have actually had a junior medical school program that they run in the summer. And then they also have what's called the Learning Link Observation Program for students that are in college. And so I just would really like to encourage you to take a look at their websites and look at that information, because you never know what you're going to find as far as being able to dip your toe in the water and see what it's really like to work in those industries. And so thank you to Heidi and Karen for joining us this morning so early. We really appreciate the time and the expertise and just the great words of wisdom that you've provided for our students. And we just really appreciate your time this morning. Thank you so much.
Yes, thank you. Really appreciate it.
Yeah, thank you all. Good luck. Yeah.
Yes, good luck. Have a great day.
Bye.
So, Mr. Brandt, we have our next speaker, Kay, that she is joining us for this second session. So I don't know if we're waiting for more students to log in or what you want to do. So you just let us know when you're ready.
Yep. So we actually have, it's the same group of students for the whole 90 minutes. Now, some of them, if they are, well, this shouldn't be an issue anymore, but some of them may be working from home and then needing to come in. So they might need to kick out like the last 15 minutes, but we're recording as well. So we will be able to make sure this is available for everybody.
Okay. Oh, awesome. That's great. Well, I'm just going to keep moving forward then and introduce our next speaker. Kay is a clinical nurse, and I'm going to let her just kind of introduce a little bit more about what she does on the day-to-day. But same question that I asked the other panelists to start us off. If you can tell us one thing that you love about being in healthcare and one thing that maybe you don't particularly love about being in healthcare. So if you want to start us off with that, that'd be great.
Well, I think the thing that I love is patient care, taking care of, and particularly I'm a pediatric nurse. I've been a pediatric nurse at Children's, where Heidi also works. And I've been a nurse at Children's for 23 years, and I've been a nurse for 36 years. So I've been in the field for a long time, and I've done a lot of different things, from mental health to clinical care in a urban teen clinics. I've worked with a doc who has an eating disorder practice. And then I landed at Children's 23 years ago and ended up working in a school-based setting. It's a school program at Children's Hospital called Medical Day Treatment. And I've been the manager of this program. And then I returned to clinical care a couple years ago. And I realized that that is my first love. That so taking care, hands-on, being with the kids, having that joy and that honor every day to see these students who in my program are dealing with chronic medical illnesses is not only inspiring, but it's hilarious. And so not all nurses can say that, which I think is a tribute to the field of nursing, that there's something for everyone in nursing. So I would say taking care of the kiddos is my favorite thing. I'm not a huge fan of, let's see, meetings are not my favorite thing, which is why I got out of management. There's a lot of meetings involved in management, a lot of talking about care. I would say that, and just sometimes, whenever you're in a large system, it takes a lot of work to get a decision made. And that's true if you're in a nursing field and in almost any field, accounting, business, all those. It is sometimes so frustrating to know a direct path to do something, and you have to wait to get an answer through 3 levels. And then sometimes that feels like that's not the best way to take care of kids. But all of it, I understand. Having been on the management side, I understand there's a lot about safety and making sure that something is evidence-based. There's a process. And one thing I think I've learned over these 36 years is to have a lot more patience and to understand that, me being frustrated and upset about something doesn't always change the system. And yet I really have to give a plug for Children's, because if there is something that does not make sense, you can go back to, there's a process to go and say, this doesn't make sense to me. And why are we doing it this way? So that's probably my high and my low when it comes to the field of nursing. But overall, boy, it's been a good field for me through the years. So really, really, I have to give a plug for it, because it's a good field that I never thought I would go into.
Wow. Now you say that you didn't think that you would head this direction.
I did not.
What do you think was the catalyst that changed that?
Well, let me tell you, there is a story involved in that. I went to a small college in Southern Indiana, and I was going to go in. I liked mental health. So I thought I was going to be a psychologist, like the idea of going into a school, child psychologist. And then waywardly, as you sometimes do when you're in your late teens and early 20s, I left college and followed a boyfriend to North Carolina. There you go. That happens. And so I ended up being there for about 6 months and decided that was not where I was supposed to be. Went back home, and my parents sat me down and they said, we think you should become a nurse. And I reminded them that sick people made me nervous, that seeing a needle in anybody's arm or vein, particularly mine, made me pass out, totally couldn't imagine myself in that role. And they said, yeah, but let's look at, you could go into mental health and maybe do things with kids. And there's probably very little tubes and blood and that involved in that area of nursing. And I thought, what the heck? And then my mom added, you've always looked good in white, which, I'm like, and in nursing, I have never worn white. Even though I was a nurse back in the Middle Ages starting out, we didn't wear white. We wore a hideous pink dress, which was, that was it back in the day. You actually could not wear pants. And so that is a long time ago. We were nurses, we wore dresses in nursing school. So then after that, you're free. But I ended up going into nursing, and I did indeed. I started out in mental health, and I did that for about 10 years of my nursing career. Worked in child mental health nursing, which they'll tell you, and Heidi may have said this, and I just caught the end of Heidi's presentation. So I will try to give a different swing on mine, because I know she talked a lot about the logistics about nursing and finding a job and that kind of stuff. But I started out with that, and it's hard. It's not an easy field. I also in mental health started out as a new grad. Then I went into management after I was in the field for about 5 or 6 years. And it is one of those things where, adults, you can kind of say, well, they probably had some hand in what's going on with them. But with children, it became harder, particularly when I had my own children, who kind of deal with the issues that these kiddos were dealing with. And so I decided to make a little bit of shift, which is a nice thing, which is a huge plus in nursing, is that you can shift. There are so many different areas of nursing to go into. And although you may not know it at the time, each one is going to give you skills and learning experiences that are going to serve you well when you go on to the next place, which is one of those things that has happened for me. And honestly, for those first 10 to maybe 12 years of nursing, I spent a lot of time thinking, I'm not sure I want to be a nurse. And I looked at a lot of different things during that time. I went into a master's program thinking, maybe I want to be mental health, get my master's in mental health nursing. And then I decided I didn't really want to be a nurse anymore. And I did a couple other things. I owned a franchise that was called, oh my gosh, Gymboree. And we did that for a few years, working with kids in that way. But eventually was called back to nursing because it's a lot of work to own a franchise and it doesn't pay well. So I was like, I'd like to be able to have some flexibility in my life. I had young children at the time. And at that point, I was able to go part-time. I job shared with someone, which is another plus in nursing, is that you can work part-time if works out, and you can work that out with an employer, or you go into a position that's part-time, then you can do that, which is something that not all fields can say. And you can also leave the field for a period of time. And although there are, depending on where you work, the technology changes all the time. And so you do have to go back and retrain, but most hospitals or most employers who need a nurse are going to work with you. So, I did this mental health nursing. Then I worked with a physician for a while and really liked working in urban teen clinics, like that population, doing primary care. And then she had a side practice with eating disorder kiddos. I helped manage with that, with the nurse being her nurse, and with that practice. And all of that I enjoyed a lot. But then, as life does, we ended up moving from Indianapolis to Colorado. And I had a long, hard look and thought, oh no, I didn't do what they tell you to do in nursing, which is to get a couple years of good, solid med-surg experience before you go, because then you're, at least that was the word. And it still is sort of like the word on the street, although that is changing. I work a lot with nursing students, and I know that from talking with their nurse educators and the people who are their clinical faculty, that we're seeing as a society that more and more we want to keep patients out of the hospital if we can, including pediatrics. And so more and more we're doing a lot more in clinic. And so sometimes you don't need that 2 years of good, solid med-surg nursing. Although I would say, if I have any regrets, it's that I didn't do that because I missed out on a skill set. Fortunately, when I moved to Colorado and I thought, I don't really want to go back to mental health nursing, I want to do something different. But I interviewed at Children's and thought, I'll get my foot in the door there. And there just happened to be a program called Medical Day Treatment. The nurse practitioner in the program had lost her nurse that worked with her, and they needed somebody who would be able to, you need me to verify an insulin? 1 second. This is what happens. Okay.
It's all good. No worries.
Okay. So I said, okay, that I would, I was like, okay, I'm going to go into this position where there's these chronically medically ill children, and I don't have this experience, but they were willing to give a shot with me. I was a nurse with 13 years of experience, but very little hands-on skills that you might use day to day with kids. I'd given a lot of injections by that time, but when the nurse practitioner said, okay, this guy needs a G-tube feed, and I'm like, I'm not sure I know how to do that. And she spent a lot of time, which is giving a plug for mentors in your nursing career, hook on to somebody. And she taught me a lot. And what I learned, and what most people will, skills, if you do an IV stick, if you start an IV, if you draw blood, if you give shots enough time, you will learn that skill. And so it's not something I know is when nursing students come in, they're always very concerned with getting a lot of skills. Well, that is important. And it is good to get that during nursing school, but just know that you will learn that skill. Repetition is a beautiful teacher. And so I did. I ended up having, here I came in to this position with just this mental health and primary care background. And yet that has been the thing that has given me the leg up in my career at Medical Day Treatment. And I have been at Medical Day Treatment the entire 23 years at Children's, which for someone who spent 10 to 13 years thinking, I'm going to find a different job, or I'm going to do a different field, or I'm going to get a different degree. I landed here and it has been a perfect match for me. And worked part-time, sharing the job with someone during my early years in the program, managed the program for 8 years. And then in the last 2 years, I went back to clinical care. So I do a lot of those skills now. But the thing that really helped me in this field was being able to have the mental health background and also that primary care, always, being able to assess as a primary care caregiver. So that has really been the thing that has been so helpful. So that's kind of like where I ended up here. Questions?
Actually, can you define what med-surg is for those of us that
Sure.
don't know?
So medical surgical nursing care is taking care of patients who may come into the hospital and they have a surgery of some type and they have to be on the floor. A lot of surgeries are outpatient these days, but some more intense surgeries are going to end up with patients needing to have care after their surgery. So you're taking care post-op. And the medical are, it gets, they come in with a variety of things happening with them, that maybe they had an asthma attack, or maybe they have a chronic medical illness like diabetes, and they ended up with their blood sugars being really, really high. And so they have to come in and get their blood sugars under control. Or, it's taking care of patients who have had surgery and patients who have to come into the hospital, not because they're having a surgery, but because they have some kind of disruption in their health that is to enough degree that they need to be in the hospital. And certainly on those floors, you're doing a lot of cares that are very skill-based. And so you're working with pumps, you're working with all the technology, you're doing sometimes dressing changes, certainly you're doing a lot of medications on both of those kinds of floors. And at Children's, they kind of combine those med-surg, and a lot of times they have certain areas of the floors that take care of kids with, so we have kids who have cystic fibrosis. So you're going to have nurses who primarily take care of that population, because again, as you get more skilled dealing with the patient population, you have a better ability to assess them, to know what kind of meds they're on, to make really informed decisions. So that's what we try and do, is really help nurses take care of patients so they become experts at it.
So Kay, in the years that you have been in the medical industry, do you find that there's a personality type or interpersonal skills that really, really are foundational to being able to be successful in healthcare?
I do. I will tell you one thing that I saw a quote a couple of years ago, and kiddos were asked what is important to them when someone takes care of them in the hospital, when a nurse takes care of them. And what they remember, somebody who is kind. They don't always remember, and so does their family. The person who now, if you stuck them 100 times, they would remember you, and not in a good way. When you were doing an IV or drawing, but really, what's important is somebody that they see as nice and caring. So you have to go into that with a compassionate heart and empathetic, and also I think having a good sense of humor also helps. Humor is sort of a universal language. And when people are scared and they're stressed, which if your child or your family member or you're in the hospital, that's a very stressful time. So being able to come in with this kind approach and being able to help people see humor, particularly I think in peds, but probably in the adult world, although I've never been in that world, that makes a big difference as well. I would say flexibility. Things change in my day several times a day. And it's being able to say, okay, I had this plan for my day, but there's some other plans coming up. And so it's really being able to make changes. It's being able to, if two people call out, and you're working with two people who don't usually work with you, then you have to be flexible and you have to say, okay, today I may have to look at my priorities and be able to shift things around. That's another thing, is being able to prioritize, being able to see what's important in that moment. And a lot of those things come through the years, but the foundational personality thing of being a kind, caring person and being able to be flexible, you can come into nursing with that. The assessment skills are really, really important. And that's why I think it's important for people who are entering the field of nursing to find somebody who can mentor them and really look to that person and ask a million questions and never be embarrassed to not know something. I love it when I have nursing students who ask a lot of questions. That warms the cockles of my heart, because I would rather someone ask me and let me, tell them about something, rather than someone kind of be like, I don't want Kay to think I'm stupid. There is no such thing as that. So always, and the older I've gotten, the more comfortable I am with saying, I may sound stupid and I should probably, but tell me about that. And people are delighted to do so.
So are there formal mentorship type programs that exist in different healthcare facilities?
I believe there are. I know there is at Children's. Certainly, I think Heidi addressed about the new grad program. When you come in, they find a person to mentor with you. And there is a strong mentor program at Children's. Along with the new grad program, there's mentorship for people who are been in the field. Maybe they just came to Children's, or maybe they, they are just someone who would like to look at another area of nursing or another area within healthcare. Then you can sign up. And there are, last time I tried to be a mentor, there were too many mentors. So there are a lot of people who want to provide that, because people love, if you love what you do, you want to share that knowledge. And I'm sure most large hospital systems have that. And again, in a smaller facility, I would, they probably, it's not as formalized, but I think, I know a new grad nurse who went into a doctor's office, and then they put her for like a month with a seasoned nurse to be able to give her support, guidance, help her with the skills, answer her questions. So I think in almost every place, certainly it costs a lot of money to bring in a new employee. So hospitals, clinics, they are very motivated to not have nurses leave after that first year or two, because that they spend a lot of money and they never regain that. So I think that that's an important thing to employers, is to make sure that you are comfortable and happy and feel supported.
So one other thing that you had mentioned about your journey into the field is that you made a transition from Indianapolis to Colorado. What did you have to do, or were there differences between the state requirements between Indiana versus Colorado that you had to kind of fulfill as you made the transition?
Not between these two states. I was able to, I did have to get a new nursing license. It's not, some states you can be reciprocal and you don't have to go through that, but it's just a matter of like, each year I renew my license. And this way I needed to go on to the DORA site and apply for that. So there weren't requirements that were different, but it differs for every state. So you might go in, and certainly you can look on the DORA site, and that's going to tell you as you're exploring new markets.
Awesome, that's great. So again, students, DORA is the Department of Regulatory Affairs. Heidi mentioned that in our first segment together. And so if there's any questions that you have about, the licensing piece of nursing and what you have to do in order to register yourself as a healthcare provider in the state of Colorado, the DORA website, which is a part of the government, is a great resource to be able to tap into. So students, again, I'm just going to invite you. We have about 20 minutes left with Ms. Kay. So if you have questions, go ahead and post those in the chat. But until I see some questions come in. There is one question about how many years in between do you have to renew your license?
It's every 2 years. And again, it's just a matter of going in, paying your money. And they ask a lot of questions to make sure that your license is not restricted, that nothing's happened in the last 2 years. And you answer those questions, you pay your money, and you're licensed for another 2 years. At this point, there is no continuing education requirement. that they have in order to renew your license. Usually, if you want to get some kind of specialty certification, there is a continuing education requirement, but not for just your basic nursing license.
So another question that's come in that I think is an excellent question, because you've been in the field for a long time, and I'm sure that you've seen evolution or shifts or trends. But one of the questions is it hard to work with mental health?
You know, it is a field of nursing that can be really challenging, both for adults and pediatric patients. But I'm sure that, you know, maybe Heidi addresses, there is a crisis in mental health right now, and there is a huge need for quality healthcare workers, from behavioral health specialists. Those are people who are usually bachelor's prepared, who work directly with the patients, to RNs, to psychologists, social workers. But it is a different kind of stress, because when you're taking care of patients who have a mental health crisis, and in the inpatient setting, they are in crisis, or they won't be in the setting. It's a little different when you work in a mental health clinic or you work in a school, but it is also very rewarding. And it is a field of nursing where you see patients for a little longer period of time, so they can come in and you can see a change. Or maybe you're working in a clinic and you work with them over time. You can see that change, and what you're doing can make a difference. And you can actually see that, which is really, you know, it's unique to I think healthcare in general. Not that it's important to everybody, but it was to me to be able to make a difference. And so that is one area that you can have a lot of impact. And we
Oh, you just got muted, sorry.
that around the COVID, this has really impacted mental health. I'm sure in the adult population, definitely we're seeing it in our adolescent and children, based on the number of kids who are coming through our emergency room lately and being hospitalized. So yep, I would highly encourage, if you're interested, know that it's gonna weigh on you. But after time, in any type of nursing, you learn a little bit to compartmentalize. If you don't survive long in the field, because you can't carry everything with you. Initially, you tend to do that, but as time goes on, you learn that you have to be the best functioning, best in the best mental health shape in order to help people with their own problems. So taking on everything yourself, it may feel like you're a hugely caring, wonderful person, but really you're not helping your patients. You have to be in good mental health shape yourself. So that's something you kind of learn over time, but going into it, knowing that that is something that you needed to put priority number one is taking care of yourself, is a good thing to learn early on in nursing.
So Kay, there's an excellent question in the chat, but I do want to follow up with a quick question on what you just mentioned. What are ways that you see other mental health professionals taking care of themselves? Like, what are some practical ways that you've seen, including yourself? How do you?
Oh, sure.
Yeah.
You know, I think that I see a lot of people that have started meditation, do yoga. I mean, I think this physical thing, particularly in the state of Colorado, where there's a lot of opportunities to do that, but I have the hardest thing for me is to keep still. So probably meditation would be a great thing for me. I don't do it, but I always think it's a good idea, and I always think I should do that. But I find that physical outlet is important. And one thing, once I got out of management, is I take now, and let me just say, disclaimer, this doesn't always happen on every area, but at Children's, it's very important that their employees take a 30-minute break. And if you don't, you get paid for it, but you have to say, I didn't get my break. And after a while, you get in trouble if you don't take your breaks, because the hospital knows it's hard, your day's hard. So on my 30-minute break, instead of like grabbing my phone and scrolling through, looking at Facebook or looking at my email, I go out and I usually take a 30-minute walk. I make sure I go outside, I get that fresh air, and I clear my mind. And some days, if I'm not going to get too sweaty and hideous, I'll go for a run, because it's just I come back and I can tell I feel better if I've done something physical. So I know that's important to me. Sometimes I'll just, at the end of the day, I live and there's Green Mountain behind me, and I'll just take a little 30-minute hike to clear my mind. And I also look to my coworkers. We have a strong bond with each other. And so if something is particularly upsetting or I'm really struggling, I look to those folks to really support me, because they know. Sometimes, like the people in my life outside of the hospital, it's hard for, they'll be like, oh yeah, that's so, I could never do that. But the people who I work with can be really good sounding boards. So I think that those kind of things are important in order to feel like you're strong mental health wise and coming in and being able to take care of not only maybe what's going on outside of work, but certainly what's going on with you and your patients.
That's great. That's great advice. So one of the questions that came into the chat, I think this is a fabulous question. Can you go into the medical field if you have a medical or mental condition yourself?
Absolutely. I think the most important thing is to make sure that you feel strong enough that it's not going to impact your physical or mental health, that it's going to be a detriment to either your health mentally or physically. But the American with Disabilities Act is something that every employer is responsible and has to abide by. So if you come in and you say, you disclose that, hey, listen, this is something I'm struggling with. I think that I can meet the job requirements, because that's something that's important. You have to be able to meet the job requirements, but you can be able to meet those job requirements. Maybe there has to be some adaptations for you to do that successfully, but your employer needs to abide by that act. Someone can't say, well, because of that, I'm not going to hire you. There may be other things that you don't meet the requirements, or there may be somebody more experienced for the role. But yes, you can come in and you should be able to feel comfortable discussing that and saying what adaptations you might need, but that you can successfully meet the requirements if the adaptations are taken. So yeah, you can. And I think there's a lot of people, my goodness, most of us struggle with something. And so I think we can all feel okay about going in and saying, yeah, if you can meet the job requirements, then you should feel comfortable applying and being honest about what you might need to be able to be successful. And if you come in and something happens, then your employer is obligated to be able to meet those, the adaptations, and be able to help you to get to the point where you can meet your job expectations.
Yeah, definitely. I mean, and I think as far as, mental health goes, like you were mentioning, Kay, it's so important that as a mental health provider specifically, that you have a way for you to be able to process some of your own mental health things, and that you have appropriate boundaries in place. Right. Because if you identify with one of your patients and you really just, your heart reaches out to them and you want to come alongside them, but you're still working through some of those mental health things yourself, having those appropriate boundaries in place is going to be really important, so that you don't become dependent upon each other. And so, or you forget that you're supposed to be a resource to that patient or to that client. And so having those kinds of boundaries are going to be really important. And I think that's where a mentor could really come into the picture to help you establish those healthy boundaries, so that you don't cross the line ethically or,
right.
medically speaking. So
boundaries are super important. And I work with a chronically medically ill population, and so many of them are just darn adorable, particularly our younger kids.
Yeah.
And we have people who come in, and all of a sudden I'm like, who gave the stuffed animal to Saw? It's like, you can't do that. You just can't do those things. And it's really hard. And we used to have a lot of, like, we'd have, and I don't work in the NICU, but people used to be Team Carly. And what the hospital realized, is that, what about if your child is not on Team Carly and you want, so all of those things, though they're so good intentioned, they, those are many of those things we just don't do. And, we're not friends with our parents or kids on Facebook. I don't give out my cell number. I don't, as much as I would love to go see a kid at their house when maybe they're out for a period of time, I don't do that because there's a boundary there. And lots of parents, they really, really want you to support them and they want to be your friend. And I want to be friendly, but I can't really be my patient's friend. And I really, even though many times I would like to be a friend with the parents, I just can't do that. And because I need to have that perspective. The other thing that I sort of learned early on is it's hard to make kids do what they need to do in the hospital, to do a painful procedure, or to have them, if they just don't want to do it, to have to be the person that says, we got to do this. And yet I know that in total, it is really going to help them and it's going to meet their need. And they don't want you to come in and apologize 100 times. They want you to be confident. They want you to be caring, but they want to feel confidence in you. So you got to be like, I know this is okay, but we're going to get through this together and I'm going to help you. And I've done this so many times. So again, having that confidence in yourself, even when I don't feel it, I try to project that. Even if I'm inside, I am panicking and thinking, oh my gosh, this is not a good situation. And I'm worried. I want to give off this air like, you know what? No problem. Got it under control. And you have to be able to be a good, strong mentally health person to be able to do those things.
Yeah. So
I was going to give a plug out to EAP, to an employee assistance program. Most hospitals have that. No shame in using the employee assistance program. That helps you find mental health. They give 6 free sessions. I have used that I would say 3 or 4 times throughout my time. Had a patient who I took care of for 6 years who died. I could not get through it with just, it just was weighing on me. And I went to someone who was totally objective and it helped me in being a better nurse from that point on. Wish I had done it long before that and have then, used it during COVID. It's really been a helpful tool.
Yeah, it's really amazing how different things impact you at different moments in time. Whether it's, a personal loss or whether it's you're watching a situation unfold from afar and you're trying to process and trying to figure out how that plays out in your own life and in your own mind and in your own heart. I think oftentimes we forget, that there are resources like the EAP, or even on college campuses, there's counseling services available. On your high school campuses, there's counseling services available that can just give you some more tools for your tool belt to be able to really process some of the difficult things that we see or that we personally experience. Excuse me. One other question that I have is about technology. You mentioned that technology is changing, it's evolving, it's continually something new that you have to learn. Are there certain basic technological skills that you would want somebody to have coming into the healthcare field?
I think you have so I think it's important to I'm not the best. I have math anxiety, but that is something that because you're dealing with medication doses, and even though a pharmacist sent it up to me, if I'm going to give a new medication and let's say it's a divided dose, or I have to look at a patient's weight and figure out if it's the right medication for their weight, even though I know that the pharmacist, it would be a fluke if they send something up incorrectly, I'm going to check that out because I'm giving that medication. That's my license. I couldn't, if someone said, okay, you gave this, and I honestly, both the pharmacist and I would be like, what happened here? And it would be a learning experience, but I would never want to give them, even if it was a Tylenol, I would not want to give the wrong dose of a medication. So having basic math skills and being able to solve for X, I learned that is important. I think just having, if you're someone, and again, when I heard Heidi say, it's important to go in and do some volunteer work, because those kind of things are going to help you, one, to know if this is really what you want to do, but also to see what those basic skills are, to be able to, have some form of assessment skills to know what range, you learn all of that at nursing school as far as what ranges are, but it's just those basic math and science skills. Those are important things to have a foundation of going into the field, and having a basic understanding of the human body, how it works, and how different systems impact each other. Those are things I think that are great to know. But just that basic math thing, I found that that was something I was like, okay, you got to have this going in.
Great advice. We have just a couple of minutes left. If anybody else has any questions that you would like Ms. Kay to answer, please don't hesitate to put those in the chat. I think the last question that I would like to ask you, Kay, is if you were talking, and right in this scenario we're talking to 9th and 10th graders at Vista, but if they had an interest in mental health or healthcare or nursing or becoming a doctor, do you have any other advice that you would give to them that they can start doing right now as a high school student?
Absolutely. I think one of the things is, and I mentioned, if people love what they do, they love to share. And so work your connections. If your mom has a friend who's a nurse, if you know someone who is in nursing school, if you know someone who works at a hospital, if you, even if you just like, I mean, honestly, I've had people who email me who I'm like, okay, they're like, okay, I know this person. My daughter's, interested. I will always be happy to share. So start doing, that's what you can start doing now. And again, doing that volunteer thing. You'd be surprised. And I know you mentioned children's. I think I see our junior volunteers back. So it's a process because, we want to vet people and make sure that they're going to be a good match. But doing that volunteer experience is a great thing you can do starting at this point. And it's really important because you may find that it's not exactly what you want. And the nice thing is, like I said, you can change things around, never feel like you're locked in. Even if you go to school and you do a couple years, it's okay. It's a little more expensive these days to make changes. So that's something you need to think about going in. But start out, work your connections, talk to people, find out what you might like, what they like and don't like, because it's different for every single person you'll talk to. But it's important to start that networking now, which is kind of, you're like, I don't want to bug people. Believe me, we love to be able to impart what we've learned through the years.
That's awesome. Thank you so much. Mike,
absolutely. This is delightful.
Yeah, Mr. Brand,
good luck to all of you.
I'm going to turn it back over to you, but students, again, just thank you for being with us. And Ms. Kay, thank you again just for sharing your journey with us. And I hope that you stay warm today and,
absolutely.
Maybe spring will be here soon. But Mr. Brandt, I'm going to turn it right back over to you.
Thank you. Well, thank you both, Ms. Grace and Ms. Kay. I really appreciate these opportunities we've been able to provide for students and humanizing what some of these career paths can look like. I did just briefly in the chat for students' reference, we are working with the Pikes Peak Business Education Alliance. That is going to be a website where we assign those virtual experiences and then realize we kind of overwhelm them a bit. So if you are still interested though, please do look at that to a resource. Just realize it might take them a little bit longer to get those set up for you with the virtual interviews. And then if you are, as Ms. Kay had promoted, get out there, start, getting your hands on, get out into the field there, start working with some of these professionals directly, that we can look at those opportunities on the PPBEA as well. That's pretty much it. We're going to wrap up. Again, if you got friends who weren't able to jump on the call, let them know. We'll have this recording, should be posted later today on Google Classroom. And you guys have a great day. Thanks, Grace.